Widespread AI adoption has taken a lot of decision-making out of the hands of America's workers, but a new investigation alleges one healthcare giant may have been giving the algorithms too much power. According to a Stat News report, UnitedHealth pressured its medical staff to cut off payments for seriously ill recuperating patients in lockstep with a computer algorithm's calculations, denying rehabilitation care for older and disabled Americans, and ultimately leaving patients and employees to deal with the consequences. For more here, let's bring in one of the names behind that investigation, Bob Herman, a healthcare reporter at Stat News. Bob, welcome. This was a subsidiary, am I correct, of UnitedHealth, not UnitedHealth itself per se, that was governing payments to rehabilitation facilities and nursing homes, correct?
Yeah, that's right. Thanks for having me. The company at issue here is called UnitedHealth, and UnitedHealth bought them back in 2020 for a couple $2 billion. And so even though it's a subsidiary of UnitedHealth, it's still intertwined with UnitedHealth itself. UnitedHealth is the largest provider of Medicare Advantage plans, which are private plans for Medicare beneficiaries. So anyone who has a UnitedHealthcare Medicare Advantage plan, ultimately their care is handled to some degree by UnitedHealth. And this is the company that was using its algorithm to dictate the care that people got in rehab facilities.
And so boil it down to me in simple terms. In other words, if I have just had, let's say, major hip surgery, and my doctor thinks I should have 10 days in a rehab facility, but UnitedHealth says, no, 6 days is all you get, then you're stuck. You're out after 6 days, or you private pay the rest, right?
That's right. Exactly. I mean, how you laid it out is pretty much how it went along. And the big part of this investigation is we knew that this had been going on. We knew that an algorithm was telling patients you only get 16 days in a nursing home, right? What's different is UnitedHealth had previously said, oh, the algorithm is just a guide. We don't make hard decisions, coverage decisions on it. But in fact, employees' job performance was based on adhering to the algorithm. So if a doctor or the patient themselves thought they needed more care, too bad, the payment denial came. And to your point, they either go home or they spend down their savings to stay in a nursing home.
And Bob, the 1% target here in particular seems to be the culprit, which was that employees were told to keep days within 1% of what was already allowed or what have you. So anytime, if they wanted to extend that, they effectively couldn't because they were trying to hit that target. I mean, that's not so different from the kinds of targets we've seen pervade the workplace over the past couple of decades, is it not? What makes AI in particular relevant here versus if that target had existed 5 or 10 or 15 years ago?
Well, the issue is it's to the point, a 1% variance on someone's rehabilitation stay basically means that there is no variance. The algorithm
that's right.
You stay in for this long, and 1% it basically means that the algorithm is the coverage decision. There is no wiggle room. And if you're a clinical care manager who is overlooking someone, and these are people who they can barely walk 10 feet, they can't go to the bathroom on their own, and they're being told, hey, your care's up at this end, at the end of this this time period, what are they going to do? So the difference is these clinical care managers, they felt pressured. Their job performance basically relied on them adhering to the algorithm. So are they really going to go to other physicians and say, hey, this person needs more care? Probably not, because they knew that their job performance was going to be based on it.
So human beings were making the ultimate decision, but they felt, and your investigation found, that their hands were effectively tied because if they didn't adhere to what the algorithm said, they were going to get an adverse performance review, including potential termination.
That's right. And United and UnitedHealth told us, there's always physician medical reviewers at the end of the line. That might be the case and often is. But the people in front of them, these clinical care managers, these very experienced people doing therapies and rehabs, they had no incentive to really push for more care because did they want to get fired for extending someone's care? No. So it was a culture. It was a strategy. to try and make sure that the algorithm eventually won out at the end of the day.
And UnitedHealthcare and its subsidiaries said what when you confronted them with these findings?
They wouldn't make anyone available for an interview. One of their top executives, Patrick Conway, he used to be a former top official in the federal government, was not made available. All of this has happened under his watch. They stood by their NaviHealth algorithm and the care that they provide, but they wouldn't give us any information about how the algorithm is composed, nor would they really offer any detailed explanations about some of the documents that we showed and that we had obtained. So it was very minimal response.
All right, Bob Herman, thank you very much with Stat News. We appreciate your time today.